Hey, you are watching AliAziz YouTube channel.
Hepatocellular Carcinoma Understanding Liver Cancer. AliAzizQualityEducation YouTube channel provided you the medical related topics videos. So don't forget the subscription button. Hepatocellular carcinoma, HCC, is the most common type of primary liver cancer, and it represents a significant challenge in the field of oncology. As a disease that often develops silently until advanced stages, HCC has become a focus of intense research and clinical concern. This article explores the nature of hepatocellular carcinoma, its causes, symptoms, diagnosis, and the human touch required in managing this complex disease. Hepatocellular carcinoma arises from the hepatocytes, the main type of liver cells responsible for vital functions like detoxification, protein synthesis, and digestion. Unlike metastatic liver cancer, which spreads to the liver from other organs, HCC originates within the liver itself. It accounts for about 80% of all primary liver cancers and is particularly prevalent in regions where chronic liver diseases, such as hepatitis B and C, are common. Causes and risk factors. The development of hepatocellular carcinoma is closely linked to chronic liver damage. Several factors contribute to the risk of developing HCC. Chronic hepatitis B and C infections. Persistent infection with hepatitis B or C viruses is a leading cause of HCC worldwide. These viruses can cause long-term inflammation and damage to liver cells, leading to cirrhosis and, eventually, cancer. Cirrhosis, the scarring of liver tissue, is a significant risk factor for HCC. It can result from chronic alcohol abuse, non-alcoholic fatty liver disease, NAFLD, and other liver conditions. The scarred tissue replaces healthy liver cells, increasing the likelihood of malignant transformation. Aflatoxin exposure. Aflatoxins, toxins produced by certain molds found in improperly stored grains and nuts, are known to increase the risk of HCC, particularly in regions with poor food storage practices. Genetic factors. Certain inherited conditions, such as hemochromatosis, excess iron accumulation in the liver, can increase the risk of developing HCC. Metabolic disorders. Conditions like obesity and diabetes, which are linked to NAFLD, are increasingly recognized as risk factors for HCC, especially in the context of the global rise in these conditions. Symptoms of hepatocellular carcinoma. One of the most challenging aspects of HCC is its tendency to remain asymptomatic in the early stages. As the tumor grows, symptoms may begin to appear, including unexplained weight loss. Rapid, unintended weight loss is often one of the first signs that something is amiss. Upper abdominal pain or discomfort in the upper right side of the abdomen, where the liver is located, can indicate liver problems. Jaundice, a yellowing of the skin and eyes. Jaundice occurs when the liver fails to process bilirubin properly, often due to liver damage or bile duct obstruction. Swelling. Abdominal swelling or a noticeable mass may occur as the tumor enlarges or as fluid accumulates, ascites, due to liver dysfunction. Fatigue and weakness. General feelings of fatigue and weakness are common in patients with advanced liver disease or cancer. Diagnosis of hepatocellular carcinoma. Diagnosing HCC requires a combination of clinical evaluation, imaging studies, and, in some cases, biopsy. The process often involves imaging techniques. Ultrasound, computed tomography, CT, scans, and magnetic resonance imaging, MRI, are commonly used to detect and characterize liver tumors. These imaging modalities help determine the size, location, and extent of the cancer. Blood tests. Blood tests can measure levels of alpha-fetoprotein, AFP, a protein that is often elevated in patients with HCC. However, AFP is not always reliable, as it can also be elevated in other liver conditions. Liver biopsy. In cases where imaging and blood tests are inconclusive, a biopsy may be performed to obtain a tissue sample for histological examination. This is particularly useful in confirming the diagnosis and determining the tumor's grade. Staging. Once diagnosed, HCC is staged to assess the extent of the disease. The Barcelona Clinic Liver Cancer (BCLC) staging system is commonly used, which considers tumor size, liver function, and the patient's overall health to guide treatment decisions. AliAzizQualityEducation YouTube channel provided you the medical-related topics videos. So don't forget the subscription button. Treatment options. The treatment of hepatocellular carcinoma depends on the stage of the disease, liver function, and the patient's overall health. Treatment options include surgical resection. For early-stage HCC, surgical removal of the tumor, hepatectomy, offers the best chance of a cure. However, this is only feasible in patients with good liver function and without widespread disease. Liver transplantation. In cases of early-stage HCC with cirrhosis, liver transplantation can provide a cure by removing both the tumor and the cirrhotic liver. However, the availability of donor organs is a significant limitation. Ablation therapy. Techniques like radiofrequency ablation, RFA, and microwave ablation use heat to destroy cancer cells. These are typically used for small tumors in patients who are not candidates for surgery. Transarterial chemoembolization. TACE is a procedure that delivers chemotherapy directly to the tumor while blocking its blood supply. It is often used in intermediate-stage HCC to shrink tumors before surgery or as palliative treatment. Systemic therapy. For advanced HCC, systemic treatments, including targeted therapies, for example, sorafenib, lenvatinib, and immunotherapy, have become standard care. These treatments can help control the disease and prolong survival. Palliative care. In cases where curative treatment is not possible, palliative care focuses on managing symptoms and improving quality of life.